try to slow down a little bit.
You're okay. You're not talking too quickly.
All right, Yong-Chan, we're gonna open it up to you.
Sure. So let me share my screen first. Let me see. Can you all see my screen?
We can see the presenter view. If you want to click.
Just a moment. I need to change my settings here.
Sure, no problem.
It's somewhat slow.
We can see it. Looks great.
Oops, I clicked the wrong button. Just a moment. Oh, yes.
Looks great.
Okay, so I'm Yong-Chan Rhee. I'm going to be the presenter. And my co-author is Dr. Charles Menifield, who was our previous dean at Rutgers University at Newark. So our title we have here is The Usage of Racial Cues in Police Killings. So we are going to talk about a bit sensitive issues at the moment. It stopped. Oh yeah, it works. So as we all know, there are a lot of debates over police killings of racial minorities in the US, and there are conflicting findings over whether minority citizens are indeed targeted by police in the US in social science in general. So I'm talking about both scholarly literature and media. Vast majority of studies in public administration, concentrate on how to minimize the bias such as representative bureaucracy, but very few studies we've seen so far in the field have empirically examined how racial minority students are mistreated by police, given that criminology and psychology and other fields of social science have provided contradictory findings. So the goal of this paper is to reconcile conflicting findings in police killings and provide one of the few empirical evidence that there is some sense-to-male relationship between officer race and victim race depending on specific conditions. So there are some past literature for this topic. So past studies try to address this crucial question. Are racial minority citizens targeted by police? But answering this simple question has been quite challenging in social science in general. For example, Smith et al. In 2017 and Cesario 2022, that's very recent, show that empirical evidence on the bias of policing, well, we are talking about killing, shooting, stops, and so on, have presented conflicting findings. Also, they argued that these studies suffer from methodological issues, weakening their core points in the papers, regardless of their results, whether they support it or whether they don't really support the findings. So before we move on, we need to talk about the theory we use in this paper. So there is a theory in psychology called signal detection theory. What it's about is about the theory explaining on how human beings make decisions based on the given stimulus. So it doesn't really necessarily have to be about an arm status only, but criminology studies have used arm status for the signal. So when you look at the graph here, this blue probability density curve stands for the curve of functional absence of signal, whereas these red probability density functions stand for the function of the presence of a signal. So when you look at this red line, it stands for criterion, which is the threshold for making a decision. So in this case, if there is a weapon, well, an officer is likely to make a decision. So after this threshold, and sensitivity means the psychological distance between the absence of signal and the presence of signal. So all these concepts are really crucial concepts in this signal detection theory. So it is often assumed in criminology studies that police officers are likely to set this criterion, which is the decision threshold, lower than that of non-black or maybe white suspects for black suspects. In our case, we also tested the presence of warrant issuance for the signal, because the signal can be anything according to psychology theory. And these are the literature, past literature's findings. And as you can see here, there has been conflicting findings so far, and everybody is arguing differently. For example, Cesario et al. 2019, right here, calculate and compare the odds of being fatally shot for blacks by police, given black crime rates, with the odds of being fatally shot for whites by police, given white crime rates. So what they basically did there is, well, they didn't really make it explicitly, but they explained mathematically that the denominator for black suspects is larger than that of white. So we all know what that means. But whereas other studies use something called residential census benchmark, that's the most widely used benchmark. But that's also under a lot of criticism, saying that it didn't control for anything else like crime rates and so on. So there are a lot of issues going on in terms of benchmark and bias. But one thing we want to emphasize here is that when we say bias, it is a relative term, and bias should be analyzed in relative term. So let's say, for example, it's not just about who is killed more, in other words, but also about who kills more. But conceptually, it's going to be something like 2 times 2 cross tabulation. And if we add more conditions such as signals, it's going to become 2 times 2, and even higher than that, it could be 3-dimensional or maybe higher than that. So in this respect, very few studies have directly addressed the relationship between officer race and victim race. The core reason would be it's really challenging to collect officer race, particularly because when you look at the existing data set we have so far, they don't really have officer race data. So we had to collect them manually, and I'm going to explain it further later. So our hypothesis here is that first, weapon possession is the armed status, and we think we are testing whether it works as racial key of danger, and then we use warrant issuance for another form of signal in this study, and it will stand for racial key of crime. So the research question here is, does white officers compared to non-white officers more likely to use racial cues of danger and crime against Black and Hispanic suspects? So that's the core research question in our study. So all these 4 hypotheses is about that core research question. So this is the data we use. We had to update the the data set we used before by adding year of 2016 and 2017. And the data sources come from various sources like fatal encounters, Washington Post, killed by police, lethal database, US Census, FBI, and so on. For other data that we could not find in the existing data, we had to find them manually by looking at city websites, all available news articles, court records, crime records, everything. That's how we collected data like officer race and other data that didn't exist in the pre-existing data. And the methodology we use is binary logistic multi-level technique with state level and city level random intercept with state clustered robust standard errors. So the dependent variable we use here is first Black victim. So that's dummy variable, 1 equals to Black, and 0 equals to non-Black. This is typo here. Or the second dependent variable here is Hispanic suspects. 1 equals to Hispanic, 0 equals to non-Hispanic. But just for your information, we are using suspect and victim interchangeably in this study. And the key independent variables here are, of course, white officer, 1 equals to white and 0 equals to non-white. And weapon possession equals to armed status, actually. 1 equals to weapon present and 0 equals to unarmed. And we have interaction term of white officer and weapon possession to create something like very similar to experimental setting. And we also have warrant issuance, 1 equals to warrant issues, 0 equals to no warrant. And we also have interaction term for this one too. And we have included control variables. We believe we have included much more control variables than any other rainfall studies we've seen so far. That includes Black and Hispanic population share, median income, violent crime rate, ongoing violence, mode of killing, time of killing, accidental death, victim age, and law of population. So I guess I can skip all these descriptive statistics. So this is what we mean by residential census-based benchmarked statistics. So when you look at here, let's see. So these black bars stand for the population share by race, according to US Census data. But when you look at these gray bars, it stands for the share of suspects by race. So when we divide this race of victim by this population share, we get these numbers. So as you can see here, when we benchmark to population share by race from USM data, we can see that for Black people, it's almost 3. So when we hold everything random, it should convert to 1 for other races like Hispanic or other races. But for Black people, it's especially high, which is really, so we can see that something's going on. But this kind of benchmark was under a lot of criticism in criminology studies. So this is why we need further empirical evidence like we are showing here. So the first column stands for the Black suspect model, and the second column stands for the Hispanic suspect model. As you can see, when there is a warrant issued for the Black suspect, and when the white officer involved, the officer involved is white, then we see a higher chance of killing Black suspects over non-Black suspects. So it looks like white officers do target Black if there is an issued warrant. But the interesting here is that when you look at here, as we introduce interaction term, this means when there is no warrant issued and when there is no weapon present, then white officers are not likely to target Black. We think that the reason for insignificant reason for this one is that because police officers are trained, so they don't use racial cues when there is no signal present. However, they are likely to use these cues when there is warrant issued. There is an issued warrant because it works something like some kind of pre-given information. That's what we think. But as we can see here in the Hispanic victim model, we can see that all these results are insignificant. So we think that white officers are not really, they are unlikely to target Hispanic according to our results. So we also calculated marginal effects for this effect, and it showed that they are more likely to kill Black over non-Black by 11.9 percentage point. So we want to emphasize each 11.9 percentage point because we are not saying that non-white officers are not killing Black people. It's more like, well, all police officers do kill Black people, but it's more like likely that it looks like white officers seem to kill more Black than non-white. That's what we mean. And we also did some calculations here, but I guess I can skip this. This just means the likelihood ratio for killing Black by white is higher than that of non-white officers. This is what it means. So I guess I can skip that one. So theoretical implications here would be there are 2 possible explanations behind it. The first possibility is figure 2A, and the second possibility is figure 2B. And I believe I'm running out of time, so I will make it as brief as possible. So the first possibility is that even when the criterion remain intact on the same place, as you can see in both graphs, when the graph for the presence of signal shift to the far right side, then the following result is that the higher average for perceived threat for the presence of signal, and it's more likely that the final outcome, so there will be this area. Where's my pen? This area gets bigger and bigger when the graph for this presence of signal shift to the far right side, and this is when we see the probability rising if there is an issued warrant. Another possibility is that the variance for this presence of signal is lower than that of non-Black. Even in this case, we see a higher probability when there is an issued warrant, but we think the first case is more likely because there are multiple studies arguing that people are more likely to associate Black people to perceived threat. So in this graph, you can see the average perceived threat is higher when there is a signal present. So we think that this first possibility is more likely than the second case. So that's our tentative conclusion. So we argue that white officers compared to non-white officers, are not likely to target minority citizens without the presence of a weapon or an issued warrant, which are similar findings to past studies. But the usage of racial cues do exist, and white officers seem to be affected by racial cues, like we've shown here, whether they recognize it or not against Black citizens. So that's our conclusion here. But there are also some limitations, like we didn't analyze other racial groups due to insufficient observations. We do not present a clear solution for the problem identified in this study. So that's all for this presentation. Thank you.
Thank you very much, Yong-Chan. Excellent presentation, and I look forward to hearing more in the discussion later in our session today. Our next presenters are Emily Lowery and Angela Jordan. And you should be able to share your screen.
Angela and I have different presentations. I don't know how it missed the program.
Oh, okay, no problem. We'll make that work. Emily, or would you like to go before Angela, or?
It doesn't matter. What was I going to say? How long do we have for the presentations?
Well, about 10 to 15 minutes.
Okay, about 10 to 15 minutes. Sure, I'll go first.
Okay, great. You should be able to share your screen.
I want to.
I'm sorry, did you say you were not in the program?
I am in the program.
Oh,
it lists them both as the same presentation.
oh, okay. Okay, let me fix that. But yeah, I'm glad you guys have worked it out.
Okay. So yes, do I have screen share capability?
You should, yes, yeah.
Uh-oh. I'm gonna escape and share my screen. Okay.
We can see your screen. It's just the all of the slides.
Okay. How about now? Okay.
It looks great.
Thank you. So, hello, my name's Emily Gilleylen-Lowery, and I am a PhD student at Jackson State University. And for this research project, I evaluated the effectiveness of the Second Chance Act in reducing U.S. recidivism rate. Okay, so here's the problem. In the United States has the highest recidivism rate in the world. The U.S. has the highest prison population in the world, and 25% of the world's prisoners are in the United States. With 600,000 convicts being released every year, approximately 10,000 of those prisoners are released each week, and 44% of those convicts return to prison before the first year of release. So back to prison every year, that's about 264,000 prisoners. And you can see here at our rates in the United States as compared to other countries. And we're only second to us is Rwanda and Africa. Causes of prisoner recidivism in the United States: social interactions during incarceration, lack of employment and economic opportunity, depression, lack of reintegration into society, and unchanging lifestyle and social circle upon release, underlying problems causing crime not being treated during incarceration. Okay, so who does this problem affect? African Americans are disproportionately affected by recidivism. And so you'll see that Blacks are most affected at 39%, and that Blacks are only about 12.2% of the entire population of the United States, whereas whites are make up 35% of the recidivism, but they make up 60% of the United States population. The consequences of the problem: $39 billion per year to maintain prisons, and 12 to 14 million in ex-offenders are working age. 76.6% of the ex-offenders are rearrested for a new crime within 5 years of release. The consequences, if not addressed, there's an impact to children and families whose loved ones are in and out of the correction system, where we also suffer as a society from monetary cost. The families suffer from emotional and monetary lack of monetary gains. So how does the problem affect convict itself? Themselves have loss of family when they're in and out of the system, reduces reduction in employment opportunities and lack of rehabilitative programs and hopelessness, not feeling like they can't catch a break. Their children suffer 1.7 million to 2.7 million experience parental incarceration at least once in their childhood. And when we talk about recidivism, these children are more likely to have their parents in and out of their lives. So the negative impacts of this is the physiological and physiological strain, the antisocial behavior where they shut down and suspension and expulsion from school, from acting out, economic hardship, not being able to have the different things that they may need during school, criminal activity. So when children are not able to get what their counterparts have, they may engage in criminal activity to make themselves, fit in. And then there's the community, the loss of contribution to the economy, because these working individuals are not contributing to society, then we lose out on those gains. Major interventions to solve the problem. There have been federal and state and local programs since the SCA has been implemented. Congress passed the Second Chance Act in 2008, which established grant programs to stimulate further innovation at the state and local level. Some of these successful programs has been the national organizations such as Prisoner Entrepreneurship Program in Texas, and state and local organizations in Arizona, Illinois, and California with the Community Team, Safer Foundation, and the Last Mile in California. So major barriers to successful intervention would be the political ideology of the conservative perspective versus the progressive perspective, lack of adequate housing. A lot of times when inmates are released, not having adequate housing opportunities to come home, and lack of employment opportunities. The different types of release, such as supervised release to just go home, but some of them don't have home, or the halfway houses that some of them are able to be admitted to, and lack of community support. So for the literature review, I've reviewed 5 scholarly articles, and some of them explored the use of rehabilitation resources as a preventative measure and the effectiveness of the Second Chance Act of 2007. Research methodology varied by scholars. There were experiment-based studies, review of natural experiments, systematic reviews, and most data extractions were from public resources. The findings is that rehabilitation is an essential measure against recidivism. The conclusion is reentry policy and rehabilitation assistance are inconsistent among the states. So some states are implementing resources more than others. All right, barriers to reducing recidivism. The assumption is that states' variations in implementation of the Second Chance Act may significant impact in reducing recidivism in the United States. So for the research question, did the implementation of the Second Chance Act measures have a significant impact on reducing recidivism in the United States? The alternative hypothesis is that the implementation of the Second Chance Act measures have a significant impact on the reduction of recidivism in the United States. For the research methodology of this project, we looked at, this is a quantitative analysis. It's quasi-experimental, and we looked at the data from 1993 to 2021. It's an interrupted time series design. And the data was collected from the Bureau of Justice Statistics. So here's the research logic model. For the unit of analysis is individual, and the geographical scope is in the United States, and the dependent variable is implementation of the Second Chance Act, and the independent variable is recidivism. The major approach, of course, I said quantitative and quasi-experimental, and we're looking at before. We're going to have a group of before the implementation of the act and after. Okay. So the variables here are recidivism and the implementation of the act, race and ethnicity, employment, and the level of measurement is interval ratio. And we'll also look at the descriptive statistics. The significance of this research is that this is a national longitudinal study with a significant increase in the sample population across multiple states and local policies to provide an opportunity to increase generalizability of previous studies. These improved outcomes of this study can provide policymakers and agencies with additional information, which might improve the outcomes of former inmates and their families. All right, so the limitation here is that the data, the ability to expand beyond the data's limitation, and the delimitations is that we're only looking at the relevant period of 1993 to 2021. And the data collected is from both federal and state. All right, so for the theoretical perspective of this research, we looked at the social disorganization theory. And so the social disorganization theory basically talks about how the problem within communities that when inmates are released, they're going back into the same situation, and the communities are not any better than when they left them. So there's a decline within their communities. So they're walking back into pretty much a horrible situation. Causes of the crime are large social housing projects, growing up in high crime areas. And a lot of times we know in the large housing projects or in housing projects in general, there are stipulations for individuals who have criminal records, rapid population growth, lack of social welfare, lack of social capital, political neglect for certain areas, and local unemployment. So not having very many employment opportunities. So let's go to the next slide. All right, here's the data. Secondary data statistics. We looked at, like I said, 1993 to 2021. Here's a scatter plot of the federal and state parole violations before and after the Second Chance Act was implemented. So you could see over here on the left, the constant increase before the act, and after the act, we see a significant decline. However, we do see there's a spike in particular in 2019 and a significant dip in 2020. Of course, we all know that COVID-19 had a very large impact on the world, and corrections was no different. So there were a lot of inmates who were able to go home or finish their sentences at home. All right, so here is the scatter plots broken up even further. We see that there is a very steep slope between 1993 and 2008. However, the implementation, the line is slowly starting to tick downward a little in the federal parole violations. When we look at state parole violations, we had a positive slope before the Second Chance Act and a complete turnaround with a negative slope after the Second Chance Act. Okay, so here are the descriptive statistics, and here's a comparison of our means, standard deviations, and our count before the Second Chance Act was implemented. Okay, and here's our descriptive statistics after the Second Chance Act was implemented. So just kind of a more detailed breakdown of our graphs. And we also did run a t-test before the Second Chance Act's implementation. and a T-test for after the Second Chance Act implementation. And what you'll notice here is that if you look on this chart, our P-value is less than our statistical level of significance. So we will reject the null hypothesis that the recidivism rate has not declined since the Second Chance Act, and will accept the alternative hypothesis that recidivism has declined since the implementation of the Second Chance Act. And that is the end of the presentation.
Thank you very much, Emily. We look forward to discussing your presentation later in the session. We'll go ahead and turn it over now to Angela Jordan, who can present as well, if you wouldn't mind unsharing your screen, Emily.
How do I unshare? Stop share.
Yes, ma'am. Thank you.
Mhm.
Angela, are you able to share your screen? Great, we can see your screen. You are on mute, however.
Okay, now let me go back to sharing. Okay. Okay, can you guys see my screen now?
We can, yes.
Okay. So I am very early in my process. I just started my research. But what I am looking at is
Are you able to put it in PowerPoint in presentation mode?
yes, I believe so.
Keep going to the left, all the way from the beginning. There you go.
Okay, so policing for profit, seizing assets in an
Oh
equitable.
my God. So are you able to undo that? Because we're seeing your notes.
So go up
Just-
to display settings. And click-
Just exit out of there. Oh, I see what you're saying.
Yeah,
Just-
go to display settings and click the little arrow button right next to display settings. The
Not
little
see-
drop, click on display settings.
The
to the
next one
left.
over to the left.
Okay.
Click on that and then just say swap presenter view and slideshow.
There you
There you
go.
go.
Okay, here
Thank
it
you.
is. No problem. Okay, so my problem statement is the Black and Hispanic communities are disproportionately victim of inequitable fines, fees, and property seizures. This is just a sample of a pattern of discrimination, and this is in particular Ferguson, Missouri Police Department, and showing that 85% of the vehicle stops are African American. 93% of people arrested in Ferguson were African American, and African Americans were subjects in 88% of the cases involved use of force by police officers. I'm going to cover some of the findings of fines and fees and fines. I will go over some examples, some of the statistics from law enforcement agencies, some of the common practices, why seizures occur, and what I've found so far. And again, this is very tentative as far as my research is concerned. Some of the fees and fines that are occurring is transportation fees. These include parking tickets, speeding, and other traffic-related items. Criminal justice fees, such as court fees, fees for cause, and other things related to being in the criminal justice system. The quality of life, fines and fees, utilities, water fines, and other things that criminalize poverty and people experiencing homelessness. And lastly, collateral consequences of unaffordable fees and fines. So what we found, according to the U.S. Census Bureau, was that fees are often used as surcharge to fund local government services, and these fines are based on that they are used as a form of punishment for violating, or at least by law enforcement indicating that an individual has violated municipal codes or laws, and these generally lead, and some of them lead to property seizure. So Ferguson, Missouri is an example that was used because they seem to disproportionately fine in their citizens, and particularly Black and other minority citizens. And they collected $2.6 million in court fines and fees. It was the city's, and this is 2014, it was the city's biggest source of income of the 20 million that it collected in revenues. And Blacks were 67% of the population, but was 86% of the motorists stopped by police. Whites were up to 29% of the population, but only 12.7% of vehicle stops. According to the U.S. Department of Justice findings, 85% of vehicle stops in Ferguson is African American. 90% of the citations belong to African Americans, and 93% of the arrests. And again, this is despite the citizenship population being 67%. Property seizure, another example, locality that we utilized was Brookside, Alabama, which has a population of 1,253 citizens. In 2018, Brookside law enforcement towed 50 vehicles, and in 2020, it was 789. The fines were connected with these tolls, increased the city's revenue, and it actually increased it by 1,478%. If you look right here in the red, these are fines and forfeitures that made up the revenue for the city of Brookside. Because of the conditions in the city of Brookside, and because things escalated so rapidly from 2018 to 2020, the state of Alabama requested a state audit because the revenue in Brookside soared 640%, and fines and fees made up half the city's total income. So when looking at this situation across the United States, some of the things that we found was that in hundreds of jurisdictions throughout the country, fines are used to fund significant portions of law enforcement budget, especially for small towns in our country. More than 600 jurisdictions contributed more than 10% of general fund revenues. At least 284 of these governments, the revenue from fines and fees was more than 20%. And more than 720 localities reported annual revenues exceeding $100 for every adult resident. So as it relates to asset seizure and forfeiture, these are the dollar values attached to actually seizing property. In 1996, it was 93.7 million, and it increased drastically. In 2004, it was 567 million, and through the years, going through 2020, where the amount has increased to $2.86 billion. And it is estimated that 85% of forfeiture instances, the property owner was never charged with a crime, and the property was retained by the law enforcement agencies. So when looking at the states in the union, we found that in 13 states, there has to be a conviction in order for law enforcement to keep the assets. In 22, prosecution has to prove by a preponderance that there was a crime committed. In 5 states, the property owner has to prove by a preponderance that a crime was not committed so that they can keep their assets. And 28, prosecution has to prove clear and convincingly. And 4 states, the prosecution only has to prove that there was a reasonable doubt for them to seize the property, and they're able to keep it. In 1 state, we found that the prosecution only has to have slight evidence. And 4, it has to be a criminal charge for the forfeiture to occur. And what we found was that in situations where there's a third party, say someone is driving your vehicle or renting your property, in 34 states, the third party needs to prove that they are innocent, that they had no involvement in whatever they're being accused of in order to keep or retain their asset. And in 16 states, the government has to prove that the third party knew what was going on in order to retain the forfeiture and profits from it. So my early findings are that policing for profit is turning some police forces into aggressive patrolling units. Several motorists have reported being harassed and falsely accused. Out-of-towners have been detained in some small towns, and the asset forfeiting caused them large fees, hotel fees, to stay and resolve the situation in either retaining or retrieving their assets, or charges that may have been charged, having to fight them. The habit of policing for profit is primarily driven by smaller police departments with limited revenue resources. And attorneys in several states have started class action lawsuits against officers, against tow truck drivers, and other police department employees for these practices. In 2019, the Supreme Court ruled its constitutional ban on excessive fines, and this is supposed to apply to state and federal government. And again, my research is early. I'm looking forward to getting deeply involved with this, and hopefully by next year's conference, I will be much further in this and have some results for you guys of what it is that I found out in my research. And this is just some of my research references. Thank you.
Thank you very much, Angela. We look forward to talking about your presentation later in the session. So our next presenters are Dr. Sumbo, Matuza, and Noah. I am not sure how to say your last name, so I don't want to butcher it. I apologize.
All right, thank you. So I think I'm going to have my camera off, so at least you can capitalize on the bandwidth.
Okay, no problem.
Okay.
We can see your screen. Great, looks great.
All right, thank you. All right, so my name is Ndhlovu, and I'm a student, a PhD student at the University of the Cumberlands, and that's located in Kentucky. And thank you for joining me and my co-presenter, Dr. Sombo Mzata. This presentation is going to look at the challenges of implementing the pre-exposure prophylaxis program, a case study for the state of Indiana. This is the outline for the presentation. Yeah, as you can see, so there are approximately 1.2 million people living with HIV in the United States. And it is estimated that 1 in 8 people living with HIV in the US don't know they have it. So the key is testing, and ending the epidemic is going to call for people ensuring that they are doing their due diligence in having an HIV test. As you can see up here on the graph, minority groups are disproportionately impacted by HIV. The most impacted are Black people, represented in blue, as depicted there on the graph, with a with the highest range of diagnosis, ranging from the graph captures the data from 2008 to 2020. So as you can see, the trend is heading in the right direction. A downward trend is what we hope to see. HIV can be prevented using PrEP. So PrEP is an acronym which stands for pre-exposure prophylaxis. So prophylaxis, in other ways, it simply means a prevention. The PrEP medication comes in two forms. There is the pill, or there is also what is called the injection or injectable. There has been, PrEP has been shown to be very effective in preventing HIV infections with an efficacy rate of 99. So having something at 99 is always a good thing. So the CDC has shown, as depicted there on the graph, that though 25% of the people living with HIV were people who are at the higher risk from contracting HIV, were eligible for PrEP medication, but unfortunately, we see only a small percentage, especially for the racial groups which are predominantly affected as depicted on the previous graph. This is a concern, as only 9% of Black people assessed PrEP compared to 66% of the white counterparts. The inequity is not different from what we see in other sectors of the United States. And this is obviously something that needs to be addressed. As a response to the identified low access PrEP numbers that we've seen, a life-saving medication among Black people is available, provided that a lot of people are exposed to this medication or made aware. So this study is a first in a series that will explore various questions. The first question is to explore the challenges of implementing the pre-exposure prophylaxis program or PrEP. For this study, we adopted a Levesque conceptual framework for the healthcare access to help understand the challenges of the pre-exposure prophylaxis program. So in this model, which was developed in 2013, healthcare access can be summarized to have two components. So as you can see right there on top and right there on the bottom. So the institutional arrangements, which is what you're seeing right there on top, and the personal responsibilities is the boxes that you see down there below. So the institutional arrangements include approachability and acceptability, availability and accommodation, affordability, and appropriateness. While the personal responsibilities include the ability to perceive, ability to seek, the ability to reach, ability to pay, and ability to engage. We use a qualitative research study design to gather perceptions of PrEP providers of what challenges they experience in implementing the pre-exposure prophylaxis for the state of Indiana. This was a case study approach that enabled us to have an in-depth exploration of pre-exposure program implementation. The state of Indiana is located in the Midwest with a population of 6.7 million people. It is predominantly white, with a percentage as shown there, 75% is Caucasian, and then 13.6, about 13.6 is African American, and the other racial group make up the difference. So according to the state of Indiana, this is a very important slide. It captures the crucial numbers. So according to the state of Indiana, the Department of Health, the state of Indiana had more than 12,700 HIV cases in the year 2018. Of those cases, 65% were linked to care for almost 3 months, and 70% were retained in care. And 60% had viral load suppression, which is always a good thing. It's always a good thing if people can be suppressed into care. And unfortunately, we see 30% unmet needs. So that's an area where I think there's need to be more, has to be done. So this is again a very important slide that captures the figures. So HIV prescription in state of Indiana. So 9,150 people were eligible for PrEP for the years 2019 to 2022. In terms of the coverage, the rate varied over the 4-year period, starting with 12.6% in 2019, and then increasing to 13.2 in 2020. And again, increasing further in 2021 to 17.4. However, there was a mild reduction in 2022 to 16.5%. We sent out a survey to capture, for our data collection, we sent out the survey to 12 PrEP providers, obviously for the state of Indiana, and asking them to address some of the concerns that they were seeing. So what challenges they were facing in terms of implementing PrEP. So out of the 12, 7 responded or participated in our study. So when we reviewed the challenges or the responses that we got in the first phase of our data analysis, it is easy to place them into 3 categories as seen here. So the macro, which looks at the larger systems, the national challenges, legal systems, and the economies of various states. And meso looks at the medium systems, that's organizations, communities, political parties, and ethnic composition. And lastly, the micro, which captures the family relations and individual concerns. So here are our findings of our study. So macro and meso level challenges mirror some aspects of institutional challenges in the Levesque conceptual framework for healthcare access. Micro level changes are the personal responsibilities aspects of conceptual framework. Macro challenges include those at county level, government oversights, and obviously the confusing American healthcare system. Meso challenges include a lack of training, and education, as well as uninformed primary care providers. So lastly, micro challenges included wild claims made on social media about medicines and the cost. Also, those individuals most impacted and in need experience food and shelter challenges or insecurity, housing instability, lack of medical insurance, and have mistrust towards the healthcare institution. So the implications of our study, this is an exploratory study, and the findings suggest a need to undertake a holistic assessment of the pre-exposure prophylaxis program. This is urgent and still, the program in the state of Indiana is still in its infancy, as the medication has only been used was actually approved by the FDA back in 2012. So the medication for PrEP has been around only for 11 years. So understanding the challenges of the implementation at different levels would help to address the challenges early on. So there is urgent need to engage the stakeholders to develop workable strategies around education, around training, as well as communication with primary healthcare providers. There is a particular need to understand better micro level challenges and address them. Fixing the macro and meso levels could do little to address the inequity. Addressing the micro level challenges is what would make the best and best positive impact in terms of understanding the challenges of the program. So going forward, our goal is to engage the 5 PrEP providers that did not participate in our study, because we sent out 12 PrEP providers and only 7 responded. So we hope to engage the 5 providers that didn't respond in hope of getting everyone to engage and to participate in our study. That would help us to understand what patterns they are having and the challenges reported by different agencies is going to help us to know a little bit more. So it will also be informative to include other states that are implementing the pre-exposure prophylaxis around the US. And eventually the goal is to get an in-depth understanding of the micro level challenges and contributing to addressing the inequity in the healthcare sector. So those are the references, and that's my contact information. Thank you for your attention.
Thank you very much, Noah. We look forward to learning more as your study evolves. And so I'm going to quickly present my research now, and hopefully try to leave some time for Q&A at the end. So if you all wouldn't mind helping me make sure that I'm showing my screen properly. Can you all see my screen? Oh wait, it's not on today.
Yes.
Okay. Are you seeing notes or the full screen?
The full screen.
Full screen. Okay, great. So good morning, everyone. This morning I'm presenting on, my name is Lindsey Evans. I'm an assistant professor at VCU in the Wilder School. And this morning I'm presenting on some preliminary research that's ongoing this semester and this summer, looking at promoting leaders of color, evidence from a specific program that's in the nonprofit and association sector. So I'm going to just review the background, the methodology, and the implications of the study. And so here we're using diversity, equity, inclusion, these concepts that we all know very well here in this space. And we're really grounding our diversity, equity, and leadership discussion in the public administration space. So overall in the nonprofit sector, we know that employees of color are a much smaller percentage of employees in the nonprofit space. And on top of that, leaders and managers, senior managers within the nonprofit space are much less represented. And so what we're interested in doing with this study is exploring and speaking directly to leaders in this space, in the nonprofit space, to learn more about what helped advance their career, what did their career trajectory look like. And we're also really interested in if participation in specific leadership development programs had a significant impact on their career trajectory that led to senior leadership positions in the nonprofit sector. I'm skipping through a number of things. So we're using several theories right now for our development of our study. We're looking at organizational theory and development and behavior, representative bureaucracy, and also expectancy theory is incredibly relevant in our study. So what are our research questions? We want to look at the career trajectories of individuals of color and compare those to individuals who've engaged in really concrete, formalized leadership development programs with leaders of color who did not participate in these formalized leadership development or professional development programs. We want to explore what the career barriers or personal deterrents were in remaining in the nonprofit leadership space, and also more importantly, what helped them overcome those barriers. We're interested in their perceptions of professional leadership development, both of those individuals who have gone through formalized leadership development programs and those who have not. And we really are interested to see, is there a real relationship between the leadership development programs that are focused specifically on minoritized populations and their career pathways? So we're looking at a program that's housed at ASAE. It's called the Diversity Equity Leadership Program, and it's been around since 2000. The reason that we're interested in this program is it is a very formalized leadership development program for individuals who are from minoritized communities. There's been about 200 participants who have participated in the program from 2000 up until the 2021 cohort. It's a 2-year program. And we also hope to have a comparison group of other minoritized individuals who are in senior leadership positions but did not participate in this specific program. So the way we want to do this is we're going to do participant interviews of those individuals, and we'll do surveys of those who went through the program and those who did not. The ways that we're going to go about doing this is snowball sampling. So we're doing one of the hardest methodologies that I've ever done. And we have a listing of the individuals who've gone through the program. We're reaching out to them. And once we've contacted them and they've participated in our interview, we're going to ask them to recommend individuals, other leaders in nonprofits that they would recommend talking to us as well. And so that's how we're going to develop our comparison group. So fingers crossed here that this works out as well as we hope. And so what do we plan to do in terms of our analysis? We'll do some thematic coding to uncover the patterns and trends relative to the interview protocols. And then we also plan to do a follow-up survey with our 2 different groups And we'll run some descriptive statistics to look at frequencies and some bivariate correlations related to demographic characteristics and some other factors in terms of leadership development, career pathways and barriers, to help us really and cover better the questions that we're looking to examine in this exploratory study. So that is a very quick overview of our study, but I wanted to leave time here at the end so that we could all discuss. So thanks for letting me be really brief here today, everyone. Am I still sharing my screen?
No, we can see you.
Okay, great. That's the fastest presentation I've ever done, y'all. So thanks. Thanks for allowing me to go through it very quickly. So we had some really wonderful presentations today, and we have about 12 minutes remaining before our next closing session here at COMPA. And I want to make sure that everyone can get a question. And so we're going to start at the beginning with Yong-Chan. Thanks so much for your presentation on policing and the identities of the officers and the individuals. Did anyone have any questions for Yong-Chan? I thought that your presentation was really interesting. I love the way that you went about exploring and your methodology there. I was a little interested in learning more about your control variables that you use there, Yong-Chan. And I didn't know if you had a minute and you wanted to tell us why you identified those as control variables and why they were significant for your study.
Sure. So, should I share my, maybe that's not necessary. So we try to include both individual level and city level control variables. So when we look at other literature in other fields of social science, such as criminology and sociology, the common limitation rate so far, especially about experiments, is that they don't really resemble real world variations. So there are a lot of studies arguing that a lot of studies out there are kind of flawed. That's what the term they actually use, because they didn't really control for many factors. For example, let's say Black population share, that's really important because we want to rule out the possibility that Black people are simply more likely to be killed just because there are more Black people in the city, for example. And we also included victim age, for example, because there are some studies arguing that racial minority citizens who are younger tend to be more killed by police. So we wanted to control for that factor too. Also, we analyzed whether gender does affect these outcomes, but we found out that gender is insignificant. So we rolled that out as a control variable. So we didn't include gender because they are insignificant because of, model efficiency issues. And we also included median income, violent crime rate, and the population size of city to control for context of crime and economic context. And we also wanted to control for the possibility that people are more likely to be killed in larger cities. And there were also studies arguing that there are likely to be more crimes in bigger cities. And we also wanted to control for rural and urban settings at the same time. And we also control for more individual level characteristics, such as time of killing. There's something called a hypothesis of bail. So they argue that police officers may not be able to discern victim race when it's night. So we also control for that factor. And for ongoing violence, that means 1 equals to there was ongoing violence when the police showed up. So that's the reason why police showed up at the scene. And they were close to, there was no ongoing violence. So we wanted to control for the level of violence present at the scene. So we try to control as much as possible raised by multiple criminology studies so far.
Excellent. Thank you very much. That was really helpful as we think about the frame of your analysis. And, I wish you all the best as y'all move forward with I'm assuming publication, right?
Thank you so much.
Absolutely. Thank you. Our next presenter was Emily Gilleylen-Lowery, who presented on the Second Chance Act and its impact in reducing recidivism. Is Emily still with us? I think Emily maybe had to step out. And so Angela was our next presenter who explored policing for profit and seizing assets in early stages of your dissertation research. Is that right, Angela?
That's correct.
That's wonderful. Anyone have any questions or follow-up for Angela?
Remind me, your study includes Indiana, is that right?
No, I have not included anything from Indiana yet. I'm still early, but I'm looking at small towns in America. So I'm definitely gonna go look at some of the northern states. So far, most of my research has been southern part of the country.
Apologies. The presentations are blended together. I'm not a morning person. But one of the things I did notice on your map, you had put the map up there, right?
Yes.
Yes, Emporia, Virginia stood out right there. I've also lived in that one area in Texas. It's fascinating. And I remember years ago, so I'm really glad that you are doing this research. Excuse me, I'm congested. Years ago, it may have been 2 decades now, there were write-ups in a local paper about, driving down Route 58 in Virginia, it's a speed trap, you go through, and folks know, and this is Nat Turner's home too, for folks who don't know about Nat Turner, right? You go through that stretch and you're going to get pulled. But yeah, and here I wondered too, as soon as you started presenting, I'm like, oh, you got to come to Baltimore. I'm in Baltimore now, right? So I've had my car impounded, not for criminal reasons, but for parking tickets and things like that, and impound's no fun. And I wonder if that could be included too. Like, are you including, well, everything that has been seized and kept? Or I know you also looked at items that were also or being returned. It was interesting how the states, you had a PowerPoint on that, on how the states had different variations. And that was really terrifying.
Thank you. Yeah, I pulled that from the Department of Justice, and I found it interesting that there are some states that the police simply have to say they thought or they think that there's something going on with no preponderance of evidence, and they're able to keep the assets just because they thought there might be an issue. But I actually changed my research from my dissertation because of the little town in Birmingham, Brookside, Alabama, which actually made CNN because they had made so much money, 600% increase in their revenue just by just pulling people over and actually making up some of the arrests is what they found in the audit, that they were just like, you just happen to may have passed the police earlier in some point in time and they wrote down the license plate and then they would use it later and say that there was some kind of citation violation and arrest citizens long after an encounter or non-encounter with the police. Any other questions? Thank you guys so much.
Absolutely. Best of luck as you continue with your research. It looks incredibly interesting.
Thank you.
Do we have any questions? I know that there's been some chatter in the chat regarding Emily's presentation on recidivism, and thank you, Dr. Matuza, for providing some additional resources there. I didn't know if there was any additional dialogue.
No, so I was dragged into recidivism work at some point because I like helping friends, like organizing conferences, and also Dr. Gideon, who was, I think, in Pennsylvania. Yeah,
Yes.
does a lot of work on recidivism. Yeah, so wanted me to help host a conference and yeah, I have quite some good context in that space before meeting Gideon. So there's a lady in Kenya, she's a TED speaker. She was taken into jail, a prison, and she didn't commit a crime. So so I sort of made the links and contacts for all of that, and they had a nice big conference here. And so I've done a little bit around that space, but I was sort of just dragged into it. Yeah.
Thank you so
Yeah.
much. Thank you. I am so happy that I was here today and so happy that you were here today because, you know, that is just such a gift. And I really appreciate it because if you notice, I did the parole violations because I was having trouble finding the recidivism rates and trying to figure out how to calculate them. And then time was ticking. And I was just like, oh my gosh, I've got to do something because normally people who recidivate are parole violations and they get sent back. And so I was like, you know, this will hold me over. I'll figure something out. But I really appreciate it. So I am going to email you for all of those contacts that you can think of.
Yeah,
Wonderful.
that's the beauty of COMPA.
And I'll
Absolutely.
even come to the conferences. Like I know you said that they were working on conferences. I would love to go.
Great. Well, we
Oh, I just wanted to say a plug too. Yes, and I apologize, Dr. Sambo. Thank you for mentioning Dr. Mudimura too. I owe him a paper. I apologize. I'm behind, but I've been in both of his IARC conferences as well. And Miss Lowery, soon to be Dr. Lowery. I highly encourage it. Yes.
I can't wait. I'm excited. I am.
Tony, you've been very patient with your hand up, and I apologize how long if I've missed it for long, but we'll open it up to you.
Okay, thank you very much. Ms. Lowery, I was wondering, in your research, have you been able to determine if we can do a recidivism program from a county jail system to the state, and that way to reduce that recidivism
From
and
the county to the state.
yes.
Initially, when I first started my research, I did look at like county jails and their programs to prevent recidivism, but then getting the data for those became a challenge. But I definitely am interested. But I think the link that Dr. Matusa has sent me is going to be effective because it has county data as well. So I'm going to look at that now, but I did initially start out looking at county because there was a program here in one of my counties that I'm close to that was training inmates on different skills before they got out. And so I really wanted to look at that, but then I ran into a bump in the road and couldn't find the data for it. So I think this link that you shared is going to be awesome.
Well, I used to work in a reentry program to help reduce in Harris County, Texas. So you may want to check that out. They do have a website. They keep statistics on what happens as far as the inmates come and go, if they go into housing or if they go into work, employment situations. So that's another place where you can find out data.
Okay. Thank you all so much. I'm definitely going to write all this down and research it because I was definitely looking for those things.
Wonderful. We've about 30 seconds left. Is there wanted to give the last word to Noah. Noah, I'm sorry we didn't have a chance to talk about yours in more detail, but give you the last word here. What are the next steps with your research, Noah?
Yeah, so thank you for the opportunity. Like I said, this is my first time to present and be part of this space. I'm just happy to be here, happy for the networks, and just looking forward to pushing this PrEP study to incorporate the other states and just to see if maybe that's something I can run with. For
Director for Dallas.